Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. You can see the tissues are pretty inflamed and almost have the look of kind of almost like a frozen shoulder, although you didn't really have significant restriction in motion. We can tug on the biceps, and it looks pretty good as it exits the shoulder there. We can look back around here, and other than the increased vascularity, I don't see any significant issues inside the joint yet. There's a little bit of wear and tear changes on the glenoid. But again, the most remarkable thing is a little bit of stiffness and inflammation in the tissues here. The rotator cuff injury is going to be up here to the right. And as we look up here, that's going to be the area where we've got this little partial tear to consider. We may or may not have to do anything. We're going to place a marker stitch right there, so a little spinal needle. That's a little bit of tear. So we'll place our little spinal needle basically right through this part. And now through that needle, we're going to pass a marker stitch. It's just a purple absorbable stitch. The stitch doesn't stay. It just allows us to find this area very quickly on the other side of the rotator cuff. So we'll feed a bunch of this in. A whole bunch. Okay, so we're up above the rotator cuff in a part of the shoulder called the subacromial space. And what you're seeing here is a burr, just a high-speed burr. And we're using it just to thin out this acromion, which is the bone that makes up the roof of the shoulder. We've left a little bit in the front. You can see how this was really getting pretty close to the rotator cuff in the front. Now we can remove this pretty quickly just with our burr so that this can't rub on the rotator cuff anymore. And we'll get a bit anterior and a bit lateral as well. Okay, and now when we stop the burr and have a look, we can see that there's a lot more space in the front. And so now we're going to get to work on the rotator cuff. Okay, so we're up above the rotator cuff. We've taken off that bone just to show you again. This acromion is now nice and flat. We're going to do a little bit of a capsular release to help with that inflammation that we saw inside the joint. But in terms of the rotator cuff, this is actually looking pretty good. There's our marker stitch. This is exactly why we use it. Now we look on this side, and as we rotate the shoulder, that looks okay. So I don't think you need a cuff repair there. I think we've got plenty of tricks to get you better, and I think that inflammation in the joint is going to be the main thing we go after to minimize your pain going forward. So I'm going to pull the marker stitch, and we'll keep working here, just cleaning up some of the area. But really at this point we've done a fair amount of work, and I think we're almost done. It looks pretty good. So this will be a much quicker recovery for you, which is good news. We're just working over towards the AC joint now to make sure there's nothing that could impinge on the rotator cuff over there. And what you see there is the edge. Once I rotate, what you'll see is the edge of the clavicle. That's it right there. We've already smoothed off the undersurface, but so far it's just been really a little bit of a coplaning, not really an AC joint resection. Okay. So I think this will be the end of the video. If we do anything else significant, we'll come back up and show you, but I think this is pretty much it, okay? Good luck to you now. Bye-bye.